We would like to welcome His Excellency, Honorable Joseph Delmar Yap, Ambassador of the Philippines to Singapore. Good afternoon from Manila, Ambassador.
Good afternoon. Good afternoon. Thank you for inviting me.
And thank you for granting our request for this interview. How is our Filipino community over there in Singapore, Ambassador?
Okay naman po. They're doing well. As you know, Singapore now has what we call the circuit breaker measure. So effectively, parang lockdown na rin. What they're doing effectively is only essential businesses are allowed to be open. And then everybody else, if they want to work from home. And then you're only allowed to leave your house for essential chores like buying food or visiting a doctor, etc. So no social visits at all are allowed. When you leave the house, you must wear a mask. If you do not wear a mask, you will be fined 300 Singapore dollars for not wearing a mask. So they're actually quite strict about that, and especially for OFWs, if you are caught violating, you run the risk na baka ma-cancel yung work permit mo. So that's a potential din that they can do to you, is because if you don't follow the rules, they could possibly cancel your work permit and send you home. So in general, we're all following the rules quite strict.
So compliance is quite successful naman po among OFWs. Wala naman pong nahuhuli po na lumalabag po?
Wala naman po. Wala. That we have heard of. Normally, we would know kung may reports dahil the police will advise the embassy if any of our nationals get into trouble.
How is work in the embassy, Ambassador? How is it affected? Any adjustments po with the new normal in the workplace?
Yes, unfortunately, because of the strict circuit breaker rules, we had to also adjust our work procedures in the embassy. So basically, we're doing most of the work now at home, work from home, but we maintain a skeleton force in the embassy to handle emergency cases. And then we continue to handle naman some of the activities na hindi talaga ma-postpone. So for emergency cases, we allow them to go to the embassy, but they have to schedule it first by appointment. So everything now is by appointment only. But we continue to handle siguro mga 50 clients a day who come to the embassy. Because they need, for example, hindi na kami nag-extend ng no renewal of passports in the meantime. But what we do is we extend the passport if they need it for renewing their passes, for example, and their work permits and residency. So we do that emergency extension that's allowed under these conditions. But the rest of it, everything is by appointment. But we also have naman yung mga hotlines natin where people can call us if they have emergencies that need assistance from the embassy.
Singapore's new coronavirus cases are mostly among the migrant workers in the news po, no, living in dormitories in the city-state,
Yes.
and which is among the highest number of coronavirus infections in Asia. But migrant workers, as we know, around the world have been most vulnerable during this pandemic. Are there Filipinos involved here, and how is the government addressing this? And if there are Filipinos, how are we addressing the migrant workers po?
Okay. Two things, no? We have about 60, as of yesterday, we have 67 Filipino OFWs who have been diagnosed positive for coronavirus. So 32 of them actually have already been discharged, and 35 are still in the hospitals. So these are the ones that are our cases. Now, doon sa migrant workers staying in dormitories, there are very, very few Filipinos who are living in these migrant worker dormitories. most of the workers who live there are yung mga involved in construction, in sanitation, garbage collection, yung mga ganun. Most of the time naman, our OFWs do not work in that sector. So, but there are still a few cases of people staying of OFWs staying in the dorms. So I think out of the 67 cases we have, there's about 4 or 5 of them that are linked to itong mga dormitories. But most of the people living in the dormitories are really mga Indians and Bangladeshis. They're the ones who really do most of the manual work dito sa Singapore.
The government also has a one-time cash aid of $200 for Filipinos whose jobs were affected by the pandemic. How are our Filipinos? Are Filipinos there getting this aid as well?
Yes po. So far, we have through our Polo, we've disbursed to 500 kababayans who have qualified for this help. Itong help kasi is only for those who are affected by the pandemic, meaning they lost their jobs or their pay has been cut and so on. So we have been we open up for mga applications and they have sent in those who feel that they are qualified for the aid, they have sent in their documents. And our Polo is the one reviewing the documents, and so far they have approved 500, and this has already been paid out. As of yesterday, we paid out 500.
Paano naman po kung hindi sila affected ng sakit or talagang na-lay off lang ho sila? How are we addressing our kababayan?
I think if they're laid off, they're also qualified for the help naman. But also, what happens kasi for the layoffs, many of them may choose to still stay and try to look for another work, another job, no? Although, of course, it's going to be difficult as time goes on because, siyempre, they're expecting Singapore will have a recession. But even then, there are certain places that require workers, and there are certain sectors that are. So far, and nakikita natin that's been affected are, of course, the aviation sector, the F&B, mga hotels. These are the ones that's been affected. But some of the large companies, for example, what they've done, for example, sa the aviation sector, some of them have put their employees on unpaid leave in the meantime. They put them on unpaid leave for 3 months and they repatriated them to the Philippines muna. Now, what will happen is once the industry opens up again, hopefully in the next 2 to 3 months, they will recall the employees. They will fly them back here, so they will get their jobs back. So that is what some of the big companies have done here.
May nagpapatanong po, Ambassador, what is Singapore's unique initiatives and best practices in their fight against COVID?
Health-wise, I think Singapore actually has a very good process, no, for handling it. Kasi, the way they do it, for example, is they have about 300 GP clinics spread out all over the country. So if you feel unwell, if you have a cold or you have a cough or whatever, and you want to check, you go to see these GP clinics muna. You don't have to go to the hospitals because you might be afraid baka mahawa ka with COVID or whatever. So you go to the clinics. Now the clinics, the doctor will evaluate you whether he will ask you to take a COVID test or not. Now more and more of these clinics are now actually able to conduct tests. So when they do the test, they'll send you home muna, tell you to isolate yourself. And when the results come in, if it's negative, then it's good. But if it's positive, they will call an ambulance to pick you up from your house and bring you to the hospital. And there you will be isolated. So lahat ng positive cases here in Singapore are isolated. So you cannot be sick and be at home. So lahat they bring to the hospital. Now, in the hospital, you're isolated. So even us in the embassy, for example, we cannot visit yung mga OFWs natin. So we just only coordinate through the Ministry of Health. We give them the number of the embassy, so in case our kababayans want to call us, they can call us. And some of them have. But most of the time, tumatawag lang naman sila because they're bored, they just want to have somebody to talk to. And so normally they're okay naman. Most of our cases, in fact, all of our cases are just hindi naman serious cases. So they're just in the hospital. And then after isolation, what will happen is pag wala ng what they call are clinically well, meaning wala ng symptoms, they will test you twice within 24 hours to see if they can release you. But you have to be negative 2 times before they will release you. So for those that are awaiting the test, they move them outside of the hospital to an isolation facility. So currently, actually, most of the people that are diagnosed, kasi right now there are 14,951 cases, no? But of this, only 1,889 are in the hospitals. And only 21 are in the ICU. So they actually have a very small number in ICU. But they have almost 12,000 outside in what they call isolation facilities.
Yes.
They're supposed to be no symptoms na, waiting to be discharged, but waiting for the test results. So yung vast majority are this category.
Ambassador, may nagpapatanong pa po, may mga questions kayo. If there has been any repatriation of OFWs from there back to the Philippines, and are there any plans to repatriate?
As I said, the ones that have been repatriated so far, we've assisted in 2 flights of repatriation. But these are mostly the ones that I was saying who were working in the aviation sector. So the repatriation was paid for by their employers, but we just assisted them in arranging with the airlines and also arranging yung mga process by the time when they get to the Philippines to make sure that it goes smoothly. Now, so far, wala pa kasi enough people that need to be repatriated to justify chartering of a specific flight. Kasi a charter flight requires maybe about 150, 160 passengers. So far, the people nga nagpapatulong in repatriation, we're actually able naman to put them on scheduled flights. Because Singapore Airlines still flies to the Philippines. So Singapore Airlines still has 2 flights yata a week. And then, as I said, every now and then, Philippine Airlines will have flights. So the 2 repatriation flights that we helped with, these were done through Philippine Airlines.
Okay. I just want to ask, the street food industry at this time, I'm asking not just because I'm a fan of it, but because also it is an indicator of the readiness of the small and marginal scale economy to advance to the next stage of this crisis. How is it for the street food industry there in Singapore, which is famous also for that industry?
Yeah, unfortunately kasi part of yung circuit breaker measures was they had to close down to mga hawkers. So, what they didn't close down, sorry, I take it back. They don't allow dine-in. They don't allow dine-in. So,
Okay.
take out or deliveries.
So pwede pa rin po, meron pa din
Pwede
po.
pa rin. But it has to be take out lang. So, if you buy, you go there, they pick it up and go home with it. So, bawal dun sa hawker center to eat. Again, may penalty yon, fine yon if you eat in the hawker center. Not only you, pati yung restaurant.
Tindahan, opo.
Tindahan will also be fined.
And we know that Filipinos are known for their bayanihan, especially during these times of crisis. Do we have activities there wherein Filipinos can actively participate or help na aktibong makakatulong po ang mga Pilipino ngayong panahon ng krisis, ng pandemic po?
Actually, a lot of the help na lang po is has to be virtual. It's really online dahil physically no more no more physical contact is allowed. Actually, they passed a law. They passed a law a few weeks back that you cannot have any social contact with somebody who is not the immediate family member who is living with you. So meaning, you cannot even visit a friend, kahit na dalawa lang kayo, one-on-one, bawal yon. That's against the law to do it now under this circumstance. So whatever has been done is really through the online. But a lot of people have reached out naman, and they've been able to, for example, gather donations. The embassy has actually facilitated several batches of donations of masks and PPEs to the Philippines, to the frontliners in the Philippines, which were gathered by our kababayans here in Singapore. So we've sent back. We've sent back several shipments to the different hospitals, public hospitals in the Philippines.
Okay, so maraming salamat po, Ambassador, for your time. Thank you for taking care of our Filipino community in Singapore. Please stay healthy and responsive to our fellow Filipinos. Mabuhay po kayo. Thank you so much.
Thank you po. Thank you.